Yeah. So I will be, talking briefly about the battle for our integrity and how we are facing the physical, mental, social harassment, and and how to handle it. So the aim of this presentation is almost every doctor is worried about the violence at the workplace, but very few doctors are trained to avoid it or deal with such a situation. This is very, though it is seems to be a little harsh, but yes, this is the ground reality. So we are not actually trained to prepare it up, and there is no proper curriculum to train us. So I thank Dr. Jayant once again for bringing us this kind of opportunity. The fact is that the IMA has accepted that almost up to near about 3/4 or 75% of the doctor has faced some kind of a violence at their work in their lifetime. So which is a significant number in a fraternity. I don't think that any other profession has like this kind of profession related exposure to the risk. Very few profession maybe. So the nature of violence can be of telephonic threat, intimidation, verbal abuse, physical harassment, which may be non-injurious, or maybe a simple injury to the grievous injury. Even it can go to murder level, or the vandalism and arson. So I think everyone is aware of these facts, because on everyday practice we are coming across. So probably this COVID situation, we are a little better in a situation, but again, I'm sure in pre-COVID, everyone, once you open your newspaper, there must be one or two news in everyday's news. So this leads to lot of psychosocial effect of that violence. If it is happening to that medical profession person, it can be doctor, it can be a paramedical staff, it can be nurses, it can be your any supporting staff. So they usually go into a depression, insomnia, post-traumatic stress, fear, anxiety, leading to absenteeism. And believe me, I know one of the leading ophthalmologists in India had to leave his practice slowly when he was in his peak time. So this is how a person's career can get completely demolished after facing this kind of harassment. And this is very difficult for us to accept the fact. So we need to understand how to prevent it and how to handle it. So the cause of violence, let us go from the root. Let us understand the cause of violence. That involves a lot of factors. It involves the policy factor. It involves the other factors as well. So unfortunately, Indian healthcare system. So let us discuss about how Indian healthcare system runs. It has near about closely 2% of the total budget is only fixed for the healthcare, which is nothing. And India government share into that healthcare system delivery is around 20%. So the 80% is being done by the private sector, of which the majority of those is being handled by the small hospitals who are having 30 beds or less than 30 beds, this group of hospitals. So this data we are giving from the Ministry of Health and Government of India. So that due to this poor, and at the same time the poor insurance penetration, which is little better now, but again in periphery there is, I'm sure there is the insurance penetration is much less, and so they have to spend their money from their own pocket. The patient has to spend their money, and once you have spent their money and the outcome is little bit away from what they are looking for, then the mismatch starts, and the disruption starts, and from there the violence starts. So this is again actually different policy which is leading to this. And majority of them, as we told you, the smaller hospitals are supporting the most of the healthcare system, but they don't have the proper infrastructure of the security system or the whole support system rather. So they are the most vulnerable area, and which usually the people they target to them only. Social factor. So this is again a bare truth that in India the literacy rate is not that high, and because of that, as you know, the unrealistic expectation and which actually they are paying for that money. So so they understand that we are paying so much amount of the money, so I should get the optimum result. So once they are not getting that optimum result due to any reason, it may not be the fault of the doctor, which is in majority of the cases is not there, but the doctor is or the hospital personnel are the responsible for that. And we cannot ignore the professional factor as well. As a part of the medical curriculum, all the doctors taught about the clinical behavior, but never we are taught about the empathy. I think Dr. Jayanto was just now was talking about this empathy. So this is one of the important part of the treatment, which actually can soothe a lot of hurdles and heartburns. As a part of the medical curriculum, so in clinical practice, so effective patient-doctor communication is also important. So I think these are the things that's already been covered by Dr. Jayanto very nicely. So the communication is the most important one of the part. With empathy, if you put the communication properly and if you can document it, I think that solves the majority of these, a lot of nuisances. The professional factor involves the, receiving an explanation of the occurrence of symptoms and signs. And during this course of treatment, we should discuss all those things, or at the beginning, the expenditure and the unmet expectation, which you are, forcing to some extent. So there is an urgent need for improvement of the communication between patient and doctor. This is one of the most important part. And I mean, even if it is I'll give you a small gesture kind of thing. So once some patient comes to you with a very irritated and agitated way, why doctor, this thing has not happened, I was told like this. The first thing is that if you ask them to sit in front of your chair, let us sit here. You can offer a cup of tea. That, immediately melts down a lot of, anguish into them. So the doctor's gesture, the communication, and the way you handle it is the most, important here. Obviously, some local factors which is not in your control, some local bodies, politicians, and mob mentality, they are prone to create like this kind of inciting for the violence. But almost lack of security in this government hospitals also is in the primary health center is one of the most important factors, that the people are a little bit of moving their face away from those peripheral community health service, but which is have a tremendous effect on our healthcare system. So we need to look into it. Our bureaucrats, our decision, our policymakers should look into it, so that you need to give them the protection from the undue situation. Can I request Dr. Jayanto, can I get a few more time, please?
Definitely.
Yeah. So the prevention of violence against doctor is rising due to the rates of violence of the doctors is reluctant to take up a serious case. So as you know, and this ultimately leading to what is a compromisation of the healthcare system. So unless and until you prevent it, you handle it with proper care, and then you protect your proper, yes, if it has to be, the mob cannot decide whether the doctor is guilty or not. There is a right forum for that to decide whether the doctor is guilty or not. So we need to control that mob in that particular situation, so that if the doctor or the health person is guilty, there are ample of laws are there which they can be punished. But yes, we need to handle at that point of time, which in majority of the cases, even without any fault of also doctors are victimized. The media, responsibility of the media. I think this is one of the most important thing. But again, we are scared to talk about it. The practice of the media, the practice of the medicine is not a very black and white thing. You need to understand that you are dealing with a human system, which can go wrong in any point of time. So the diagnosis is important, but diagnosis of diagnosis is a hypothetically deductive process. But even if the right diagnosis, also there are a lot of other factors which can lead to worsening of the condition. So doctors cannot be held responsible or accountable for every death or any worsening of the situation or any kind of unwanted situation. I would like to re-emphasize here that one of the I think you all remember on the pediatric NICU incidents which occurs in Gorakhpur in UP. Actually, this is lack of oxygen was there, and the entire blame goes to that doctor. So the how did we are responsible? How did that doctor is responsible for supplying of the oxygen? So like this is an example I'm giving to you. So the media responsibility is also very important, but the responsibility of a doctor is equally important. Is that you have to follow some of the cardinal rules. So you do not overreach. You do not treat beyond the scope of anyone's training and the facility which is available, which actually prevents a lot of violence and the litigation also. We ensure that a valid and informed consent is taken properly and is not just considered as a formality. This is one of the most important part of it. The audio-visual recording. It helps as a proof. It helps for the self-improvement of that person also. If you record it and if you go there and reassess the condition, you can improve your counseling part of it. And the most important is for the training program. A senior person of that hospital, a senior doctor, the counseling by the senior doctor can give an example to the junior doctors, and by that way, this is also can come into the part of the training system. So extra effort should be taken.
Sorry to interrupt you, Dr. Rupak, but with all due respect, may I request you to please sum it up in next 30 seconds because all speakers are waiting and we are delayed.
I'm just done. So to sum up the whole thing is there is a responsibility for the institution as well is there. So if the mob control and a proper security system has to be there, which can come in between between the mob and the doctor or the health personnel at the initial stage, and by that way you can dilute the situation to some extent till the police intervenes it. Now the social media harassment, how much protection we get from the law? So the law is persisting since 2000, and this is section IPC information technology of section 67. So you can just go through. There may be a 3 years or 5 years of 5 lakhs of fine, which can go up to 5 years or 10 lakhs. This is an important notice by Kolkata Gazette from government of West Bengal. I'm just giving an example of that, and you can share. You can ask me for this thing. And the new weapon which is available right now for the IT Information Act from 25th February 2021, in presence of Ministry of Information Broadcasting and the Electronics and IT Media, they have given this protection for those who are doing this kind of civil defamation in the social media can be punished. Thank you.